and welcome to my channel. This video is a suggestion from the comments section. Little Urban Prepper asked me about what my first aid kits are and what my fire kit consists of. I am really sorry about the shitty lighting. This is the best I can do, so I apologise in advance. But yeah, back to the topic. This video is going to be the first aid one, and then I'm going to do the fire kit as a separate video. So yes, before we begin, I must point out that this is just equipment I am trained to use, qualified to use. There is nothing fancy in it, like, you know, chest drains and venoms, because of stuff that I've seen in other kits, which is just quite insane. But yes, all of my kits, just so I don't have to keep on pulling them out, include, you know, a silver foil blanket. I won't get it out because it's all sterile and folded. But yeah, thermal blanket. They also all have paracetamol in, diarrhea tablets in, and antihistamines in. All my kits, bags, stuff have them in. They also have a Ziploc bag in of some type, and the reason I have this in is so any, you know, packaging or gloves or wipes, etc. that I've used, I can just throw in there and nobody else has to touch the gross stuff, which is not something I've seen in a lot of kits, but there you go. So just like the Urban Prepper, I sort of have 3 levels. Very organised, I apologise. So this is EDC level, this is Gatorade bag level, and then separately we have bug out bag, fumble, bug out bag. So yeah, so let's just crack open and get on with it. Yeah, like I said, this is EDC. It is quite full because I am the biggest klutz on the planet. So yeah, I'm just going to pull them out and show you. This is a towel that expands when you get wet, and that is purely for cleaning myself up afterwards, in case there's been like anything gross and icky. We have scissors, because all first aid kits should have scissors. We also has a, you know, gauze elastic bandage. Not the biggest, but it would do in a pinch. And then, this is something I don't think many people will carry, and this is purely because personal. And you get these on prescription, or at least I did. It is like a border bandage. It's like a cross between a bandage and a plaster, and I carry one around because I have HS. I've done a video about it in the past, I will link in the comments. And so that involves boils and blisters. Boils and blisters have this horrible, nasty habit of bursting. It is disgusting when they do. This is what I use for that. Okay, now we get that grossness out of the way. No, not plasters yet. Gloves. You should always have gloves in your first aid kit. Always, always. Micropore tape, just for securing bandages and dressings and that kind of stuff. Wipes, obvious reasons, I would hope. Another wipe. Then about 50 Brazilian plasters. No? Yes. Can I put the plasters back in? Yes. I'm having fail. Plasters. All the plasters of all the types. So we have moleskin plasters. We have blister plasters. We have, you know, normal plasters. So yeah, several types of plaster. We have I can't get my fingers to work. I'm having an epic fail. We have, you know, gauze dressing in various sizes, which is what the micropore tape goes with. We have skin closure strips. And then we have, that's just more plasters in there. We have a mouth to mouth paper shield, because when you're doing CPR, especially in the time of COVID, it just makes sense. So yeah, that is like EDC. We have a lot of crossover into the Bug Out Get Home bag. So it is that stuff I've just shown you, and then I won't pull everything out because it's just more of the same. But we also have burn gel, because in a get home situation I might have to make fires. I really hope I don't, but I might have to, and so it just makes sense to have some burn gel as well. And then yeah, this is pretty much more plasters and gauze and stuff, but I also have some cotton buds, because wound cleaning, but it could also be like a fire starter. I'm noticing that I am missing my safety pins. Good job I did this video, really. But yeah, and just so you can see, it's just more dressings and wipes and closure strips and plasters, just different types. So yeah, that is probably too much for a get home bag, but it is light and it's small and it makes me feel better having it in there, so there's that. Anyways, just shove all that to one side so I can keep them separate. And onto the Bug Out bag kit. As you can see, it has a clip, so I can just clip to my bag and separate. It is nifty. Again, this started life as an entire kit, just like that one did, but I've added it and expanded it for my own needs. Ziploc baggie, like I said. There's going to be a lot of crossover. I will try and pull out the crossover as best as I can, but yeah. These scissors are more like the paramedic shears, which is a bit better, because goodness what you're going to be dealing with in a bug out situation. This is just a different type of resusci face shield. Yeah. Cotton buds, we'll gloss over that because we've already talked about them. Gloves, ditto. Plasters, wipes. Plasters, wipes, yeah, we've already talked about them. This is saline. It's out of date saline, so I need to do something about that. But you can use this as like to get stuff out of people's eyes. I've seen people use it to get stuff out of people's noses before, and it could also be used to like clean up and cool down like a wound or a burn. So it's a multi-use item. We like multi-use items. Plasters, wipes, plasters. We'll just get rid of all of them. But not you, because you're something different. This is a tourniquet. I'm not going to get out of the sterile in the bag, but basically if you don't know what a tourniquet is, it's something you can wrap around an injured limb, like if it's bleeding or whatever, and you can tighten it, and it's meant to stop like the blood flow to help save the limb. Plasters. Gosh, yeah. Don't need to talk about that. We already have. But this is cool. This is a leaflet that came with a kit. It came from Amazon, so you can just look it up. But yeah, it's first aid, and it on the back it tells you how to, gives you like quick pointers on how to deal with like various things like eye injuries, heart attacks, burns, electric shock, bleeding, you know, stuff that you might encounter. And if you're panicking and already like flustered and stressed, it's just good to have a reminder. And on the inside it goes through your Dr. ABC. If you don't know what Dr. ABC is, it is danger, response, airway, breathing, circulation. And it's the steps that you have to take before you start doing treatment on a patient, and that is to keep you and them safe. Patient, like, you know, anybody you need to do first aid on. And then second to last, we have a bandage, a triangular bandage. The reason I don't have one in my get home bag is because I have a shamog in there and I can just double up as the same thing. And then we have this nifty kit. I'm not going to open this one, but in true Blue Peter style, she says, yeah, in true Blue Peter style, here's one I opened earlier. And again, this was something I got in prescription as part of my caring duties. And I'm just going to show you what it is all in a nice package. So this is just like, you know, the stuff that they have on the doctor's bed. So it gives you somewhere sterile to put your stuff down on. Then you have an apron, so you're going to keep your stuff clean. You have a bag to put all your stuff in afterwards. You have gloves. So we all love gloves. Yeah, this is like a dressing pack, so you get like a ruler in it. I'm not sure I would ever use that, but yep, my gloves. Some paper towels, like a pad. So this is like a dressing pad thing. And then you also get a handy tray for your water or to put your equipment in or whatever. And we had some spare from when I was caring for my relative, so I just thought that is handy to have, so I put it in the kit. Anyways, yeah, so that is what I carry first aid wise, because that is what I'm confident in using, that is what I'm competent in using, and that is what I'm clear about using. So, you know, my 3 C's: confident, clear, confident. I wouldn't be comfortable using anything more than that at the moment, so I don't carry it. Anyhow, so that is the first aid section. If you're stopping here, thank you for watching. Hope you found it useful. If you're not stopping here, I'm about to film the fire kit section, so I will see you on the other side. But for now, TTFN.